Research in clinical practice has shown that when working with and caring for clients, nurses acquire objective information about their client's condition as well as subjective or personal information about them, such as about their family and social history, their coping resources, and a myriad of other things. This information facilitates the nurse's understanding of and caring for the patient. Let's explore these patterns. In this lesson, we will review comparing and contrasting patterns of knowing and relating them to the process of theory development, applying critical reflection criteria to theories, and describing theory evaluation and theory validation. In 1978, Carper identified 4 fundamental patterns of knowing that form the conceptual and syntactical structure of nursing knowledge. These 4 patterns are personal, or the means by which nurses approach their clients; empirical, or the science of nursing; ethical, or the moral direction of nursing; and aesthetic, or understanding what is significant to the patients, such as feelings, attitudes, points of view. Each pattern alone is neither sufficient nor mutually exclusive. The teaching and learning of one pattern does not require the rejection of the others. When critically appraising a theory, you must ask 4 questions. How clear is the theory? How simple is the theory? How general is the theory? And how accessible is the theory? Some theories or models will make more sense to you than others. For example, Martha Rogers' Science of Unitary Human Beings theory is fairly complex and, well, kind of out there, whereas Mercer's role attainment or becoming a mother theory and Roy's adaptation theory are less complex. In addition to validating a theory, we must evaluate the theory, including, but not limited to, its appropriateness for our purpose and need. Use a process approach that starts with identifying the presence or absence of concepts that list and classify the nursing components of interest. Next, identify the definitions of person, health, environment, and nursing. The third step is that the theory clearly identifies what the theory seeks to describe. Next, identify the theoretical and operational definitions. Theoretical definitions explain the nature of a thing or idea broadly. It's important to note that theoretical definitions may not be applicable in everyday activities. Operational definitions explain how something works. For example, it explains what is meant by wellness or health or similar concepts. Operational definitions tell the reader which observable and measurable signs to look for when using the wellness example, a person experiences wellness. The next step is to identify the links or relationships between the terms, concepts, and theoretical assertions. And last, how are the concepts, statements, and other things organized? Are they linear? Are they highly structured? Or are they unstructured? All theories must be tested and validated, particularly when seeking to define and describe the relationship of a theory's relationship to practice. At the heart of the confirmation and validation of theory is the idea that theory suggests goals or outcomes that the nursing profession values. As you familiarize yourself with all the nursing theories and conceptual models out there, and there are a lot of them, keep these evaluation and validation purposes in mind.